So those two.
Uhotekeku wa gukorwo ati ciana ni ciragwatania murimu wa Covid-19 na gikiro kiguru gukira andu agima ni ndereti yanjitie kwenjera mirigo ku bururi-ini ona gutwika thirikari kugerera mutafariri wa mihang'o thiini wa ministry ogima wa mwiri Dagitari Rashida Man ni yugite ati uhoro ucio ndwikiritwo mukonde ona gutwika uthuthuria ni wambikitwo niguo kumenya uma wa ndeto ino.
I think the verdict is not yet out there. There are studies going on, and this is very important and very relevant, because when we talk about schools and reopening of schools, it is this kind of information that will inform us what the risks are in terms of transmission when children schools are open and children come together.
Akiheana ndumiriri egie murimu wa Covid-19 guku bururi-ini, Dagitari Amani ahithuritie ati gicunji kia 90 hari igana gia ciana iria ciathimwo murimu uyu citikoragwo cionanitie dariri, no akoiga ati uthuthuria wigie ciana kugwatania ni uguteithiriria na njira nene ona hari gutua itua rigie gucokereria kwa mathomo guku bururi-ini.
How effective that spread is still a question of debate. There is a lot of work going on to determine whether those who are symptomatic, when they do spread this virus, what is the form of this virus in such people? There is a possibility that some of these viruses in some of these asymptomatic cases may not actually be able to be transmitted to other people simply because they may not be viable. I think that question is also out there. They may not be viable to be able to continue a transmission.
Na gukorwo ati murimu wa Covid-19 ni ukuruhanagia mahuri na njira nene, andu aria magucagia thigara marerikana gukorwo mari ugwati-ini munene wa kurwara na kugwatania, riu makiurio magie na wimenyereri munene na kwigita.
Smokers often have a persistent cough, and infected Covid-19 smokers who are not yet symptomatic could be a source of spread of infection, as the cough can easily be dismissed as a smoker's cough. Those who use tobacco in any form, whether cigarettes, water pipes, biddies, cigars, or heated tobacco products, to place their health first and quit the habit.
Maya magithiaga na mbere o ringi bururi ndwandikithitie namba ya ikuũ rungu rwa mathaa 24 umuthi namba ya arwaru ikirugamira andu 114 thutha wa andu 1,682 guthimwo rungu rwa mathaa 24 andu 300 ni mahonete ihinda-ini o ta riu.
All are Kenyans except one foreigner. 93 of them are male and 21 are female. The youngest is a 1-year-old infant. The oldest is 85.
Handu-ini ha Kameme TV getwo Waithira wa Kihara.